Hello, everyone. I'm Sheldon Barlett-Rumor, and this is it. Welcome back to This Is It TV. It is so much fun when I get to hang out with my dear friend. I'd love for him to reintroduce himself, his first and last name, and all he is up to.
Sheldon, I'm Louis Bezich, men's health advocate, contributing writer to phillyvoice.com, and of course, the author of Crack the Code, 10 Proven Secrets that Motivate Healthy Behavior and Inspire Fulfillment in Men Over 50. How you doing today?
I am so good. I am so good. I was just saying, I love it when you come on here and teach me something new. I'm obsessed. It's so good. And then I get to run around the rest of the day acting like I've always known it. Meanwhile, I drive traffic to all that you've got going on. You're so helpful and you inform me every single week. Teach me. What are we talking about today?
Today, Sheldon, we're going to talk about health span versus lifespan. In effect, quantity versus quality of life. Health span, now what is health span? What am I talking about? Well, almost 20% of our lives are now spent in what's called, what the experts refer to as declining health, which is not good. So health span, what they mean by health span versus lifespan is the period of time spent in good health, free from chronic disease and the disabilities of aging. Right. You know, what's happening in the world is that we're getting better at, medicine, and we're getting better at keeping people alive. We're living longer, but the question is the quality of that time. Sure. That now we're living longer. And there's a gap of about 13 years between health span and lifespan. And so that's a real dilemma because nobody wants to, spend their time here in a situation where you can't really enjoy life and get the most out of it. So it's a real, it's a hot topic that's getting a lot more attention these days.
Well, I think that it should, because I think that even in the retirement space, like we talk a lot, I was talking about my parents and how people are retiring. Some folks are retiring a lot later. Those that retired a lot earlier aren't necessarily living the best life that they can upon retirement. There's a number of different ailments. There's a number of different things that are going wrong. And we always talk about the preventative measures that we need to take. So we're not in that space, and we're not in a space that we're not living well. We're just surviving. Is that kind of, am I on the right track?
Yeah, exactly. So, what the experts will tell us is that 80% of the years that people live with what they refer to as a life restraining condition are really attributable to chronic or non-communicable diseases, what they refer to as modifiable risk factors. What does that mean? Is that in a lot of cases, we can do something about it. Now, yes, there are people with god-awful conditions that are not, a result of those. They're not modifiable risk factors. But in many cases, again, our lifestyle can have a big impact on our health and sustaining that quality of life and that good health over the long term.
Right. These are things that we can do that are preventative. These are things that we can do that can help us to avoid just barely surviving or just getting by, but like living a very, very good life. And I think that these are smaller changes that we talk about on a regular basis to avoid, feeling bad or getting ill,
Yep. Now, it comes back to the same thing. It's lifestyle, it's diet, it's exercise, it's having some level of commitment to a healthy lifestyle. But what this notion of health span does is really put it in perspective that, there are positive consequences if you lead a healthy lifestyle, and there are unfortunately negative consequences if you don't. So, I'm always looking for motivating factors, things that will get people to kind of stand up and listen and really pay attention to the consequences of things, because you want to know sooner rather than later. And this is one of them. It's getting a lot more attention because, when we think of our aging process, again, whether it's grandchildren, travel, what have you, and travel comes up very big in terms of the research on retirement and aging. You want to be able to do it. And that's why we need to be healthy and active to enjoy it.
We need to be healthy and active. And I hope that those that are listening and watching are like, oh no, but this is like a wake-up call. This is like the nice little nudge to be like, there are things in which you can do in order to change your lifestyle, not necessarily even drastically. We talk about that a lot as well. It doesn't have to be these abrupt and drastic changes. It could be small things that make a big impact in the long run, right?
exactly, walking around the block with your spouse, eating in more moderate proportion sizes. There are things that are not totally intrusive in your life that you can do. And again, from my perspective, I've always, with my men's health, I take what I call a tough love approach. Sometimes we've got it, we love our men, and we love men and women out there,
Yes,
and everybody who's got something at stake. And sometimes it's important, and again, can be motivating to know the facts.
yeah, to know the facts and not wait until it's too late, right? Not
Yeah.
wait until whatever it is that you've been limping around on, or whatever it is that's been ailing you, gets to the
Yeah.
point where it can't be fixed, or gets to the point where surgery or additional medications are needed. We can begin to do small things now. So please just see this as a friendly reminder that there are
Yes.
lifestyle changes that can be made before things get too dire, and that you can begin to live a great life for as long as possible. Is that fair?
We have more control than we think sometimes.
We have more control. That's good news. That's good news for us in this crazy world where we feel a little out of
Yes,
control the
absolutely.
majority of the time. The majority
Exactly.
of the time. Oh, that was a good one. I feel good about this. I'm going to share this with those that I love, the men in my life, and everyone that I share this wonderful life with. I want to make sure that they live healthy and long lives as well. If people want to get in touch with you, if they want to follow, fan, and like you, as I like to say, where should they find more information?
You can find me on social media at Louis Bezich, and of course on my website, 50plusmen.com. You'll look and find everything that's going on in my world of men's health and see where I'm at.
Oh, I love it. I'm telling you, you will not be disappointed. Follow, fan, and like my dear friend. He's got a lot going on, and it's all to help all of you live a better life. Thanks so much for joining me.
Thank you.
Of
Thank you.
course, from all of us here at This Is It TV, I'm Sheldon Barlett Rumor, and we will see you soon. Take care.